am now.
Okay, my name is Derek Morrison. I'm with the Committee to Save Southeast Louisiana Hospital. This is a news conference that we called to enable Southeast workers to speak out on the question of losing their health insurance on January 31st. We're demanding that Secretary Greenstein, who's the Secretary of DHH, Department of Health and Hospitals, given the fact that people are losing their health insurance not due to any fault of their own, but due to Greenstein's effort to shut down the hospital. So we're saying that because it is the fault of DHH, Department of Health and Hospitals, that each and every Southeast worker should get a 6-month extension of their health insurance. This is the least that can be done. They should also be given severance pay in terms of those who are going to be unemployed. Even those who are working at the hospital under Meridian will not be getting the same pay that they had when they were working for the state. So we're saying the least Greenstein can do is to extend health insurance for 6 months. And this is something that the public should know about. So we'll begin with Linda Jenkins.
My name is Linda Jenkins. I was pharmacy director for 26 years at Southeast before I was laid off. I am currently unemployed. Our concern on the part of the committee is the number of employees who will not have insurance, who don't have current employment, many of them with pre-existing conditions, many of them that find their COBRA would cost more than they would have to be able to have living expenses. So therefore they're dropping insurance. Normally they would have been protected by the LSU system, but those services are locally are being cut. So there is a number of concerns about people being able to continue with needed health care, some of them with very serious conditions that require medications on a regular basis, and they won't be able to afford them. They won't be able to get the physician's care. So we're urging the DHH to continue to protect its citizens for at least 6 more months.
I'm Joan Spraggins, and prior to the layoff, my title at Southeast was Mental Health Program Director, Manager A, Director of Residential Service, and prior to that, the Director of Therapeutic Services. I have been at Southeast for 13 years as a result of a layoff when Charity Hospital closed. And I am one of those people that Linda has referenced that is in need of medical care. I've had several surgeries in the past 3 years, 12 to be exact. And as a result of the layoff, I am being forced into an early retirement. Although I have the years of service, I don't have the age. With that comes the pressure to participate in COBRA. As a single person, the quote that was given to me for COBRA coverage was $555 a month. With the forcing of early retirement, my benefits would then be reduced from 70% of my salary to 40%. There is no way, it's like NASA, we don't need a mathematician to figure out if you're going to have that much going out and that little coming in, the two can't meet. Without the health insurance, as Linda said, I would be forced to seek alternate means of health care. And with the closure of LSU and the other programs, that is almost impossible. Severance pay, we have not, prior to the layoff, we were not asked or offered any other alternatives, such as a furlough. I know that myself and anyone that I have spoken to would have been more than glad to surrender a day's pay, a half day's pay, a week's pay, a month to surplus what was told would be a $555,000 deficit for the year, for the upcoming fiscal year. That's nothing. To us, we would have done it gladly and kept the hospital open to maintain not only our jobs, our health care. This closure has not only affected us as individuals or a group of employees, it's affected the community. Southeast has been in existence for over 60 years. There are banks and stores and restaurants that employees have patronized for years and were the backbone of this community. A lot of the employees at the hospital are both husband and wife, couples that work there together. a lot of single people, single parents, single individuals. And the rug's just being pulled from under everyone with very little warning. We were led to believe, to some degree, that the closure would not actually happen until the end of June, possibly. There's a big difference between January and June in the number of paychecks and preparation that we could have made to probably sustain us a little better. This is a very devastating situation. It is, I don't see where the cost effectiveness is in the more detriment means to the community and the individuals that work there, and certainly implore whomever, however, to, as Mr. Morris requested earlier, that the health care be reinstated for at least 6 more months, and if any possibility of any severance be offered to the staff, those that are still there under Meridian, and those of us that have been laid off to do so.
My name is Jennifer Marcy. I was employed as a pharmacy tech at Southeast Hospital for a little over a year and never made the permanent status because they stopped granting that in October. Due to pre-existing conditions, I'm unable to get insurance on my own healthcare insurance. I looked into it and I could only get major medical with a $5,000 deductible and $500 a month. Because of that reason, I was forced to have an early wedding. We were planning to get married this year, but that's okay. We got married last year, my husband and I, and now I'm on his insurance. I consider myself very blessed. There's a lot of people that are probably were in my shoes where they have pre-existing conditions and can't get insurance. And they don't have that option. They don't have a spouse that works somewhere else where they can get on their insurance. So I feel for all of those people. I have friends that work at Meridian now that have been employed there with them that still don't know when their insurance is going to start. So we're all left in this boat that on the 31st, they don't know where they're going to be. And my thing is, even if you start a full-time job somewhere, a lot of the private employers require a 3-month waiting period. You take a job and you wait 3 months before your benefits become active. I think they could have at least given us 3 to 6 months. 6 months would be fair, because a lot of us stayed to the end, working in conditions and staying there until every last client was taken care of, and I just think that that would be the right thing to do.
My name is Myra Suzanne, and I was employed at Southeast Hospital for 30 years and 4 months. And I have incurred 2 health conditions at the hospital from taking care of the clients. And due to that, I continue to have chronic pain in my neck and back. And right before I left, I was moved to a new supervisor that didn't want to honor my light duty. So I went out of work because it caused more damage to my condition, which caused me increase of pain. And they did not offer me my workers' comp. Still as today, I still haven't received anything from Southeast Hospital for workman's comp. December the 4th was the day that my doctor wrote the order to be off from work. And I was treated terribly by HR there, and I haven't received anything in benefits as far as workman's comp. And I continue to go see the doctor for my condition, and I will continue to have to do that for the rest of my life unless I have to have surgery. But at this point, I don't have, they want to do surgery, but I'm holding off as long as I can. And I'd just like to say that I did the sort of early retirement. I had years, and I don't have the age, but I was able to retire. But some people said I was blessed, but I'm only getting 75% of my salary. And as a single parent and a son that's graduating this year and kids playing sports, it's just not enough. So I think that after 30 years of my younger days that I gave Southeast Hospital in the state, I think it was terrible what the governor has done to me as a single parent. Thanks.
So the question is, what will happen to you on January 31st?
Because I did the retirement and I was vested, the insurance would be covered by 75%. So I'll still have health insurance on that day because I retired. I don't have an interruption service. If I would have stayed and waited to see if I would have been able to find another state job, I would have an interruption in service. So to keep from doing interruption in service, I would have to do the COBRA, and I would have lost that. So basically, I had to just do the early retirement to retire, you know, while I was still active.
Do you know of other Southeast employees who will, as of January 31st, lose their insurance, are unemployed, I mean, besides Joan, and what are they trying to do?
I've spoken to several individuals that are facing that dilemma, and they don't know what to do because there are not very many options available. One of the young ladies whose testimony was provided here has had several strokes, and as of January 31st will lose her insurance as well. And we're praying. We're just praying day by day that something, you know, can happen, or some divine intervention, because there is no plan of action. The limitations far exceed the options that we have.
And the Southeast employees who got hired by Meridian, somebody said that they will not have health insurance as of January 31st, after January 31st?
I can only, this is hearsay. I have not spoken to anyone that is a direct representative of Meridian, but the employee statement has been that, as Jennifer said, when you are employed, you have to wait 90 days before your health insurance kicks in. And upon a job offer, maybe Sharon, you can comment on this more, job offers were made, but benefit packages had not yet been confirmed. So that there is a possibility or a strong potential that as of January 31st, they too will not have health insurance.
Sharon Floor, I'm an RN, and I worked out at Southeast for 8.5 years, 9.5. The offer that was made to me was, besides being 32% less than what I was making, was on a piece of paper. The only thing down there was an hourly rate, and verbally I was told that after 30 days one would become eligible for some benefits. Nothing was written down and that I saw, and I didn't pursue it.
The last I had heard is that there would be an insurance representative there, I guess in the next week or so, and whatever that person presented would be the insurance they would get, but that's all I know.